Hi everyone, my name is Avi Desai and I am an upcoming senior in high school. Today I will be talking about drugs, including drug use, drug safety, and more. Let's get down to the basics of drugs. There are four basic classifications of drugs based on the effect it has on the body. There are depressants, stimulants, hallucinogens, and inhalants. Let's talk about depressants. Depressants can be referred to as downers. They work to decrease function in your central nervous system and can create feelings of relaxation and euphoria in the body when taken. These types of drugs are extremely addictive and have a high risk of overdose if not used responsibly. They are primarily taken to create a euphoric feeling in the body. Examples of depressants include alcohol and opioids. Alcohol is one of the most common types of depressants. Alcohol, if used irresponsibly, can lead to some fatal outcomes. If alcohol is abused, which includes consistent heavy drinking, many side effects may occur, including throat cancer, liver failure, cardiovascular disease, infertility, and heavy dependence. Extreme mood swings can also occur, which may strain relationships with friends and family. It's always important to know your limits with alcohol and drink very responsibly. Opiates are another common depressant. Opiates are not opioids. However, the effects they have on the body are very similar. Opiates are substances, sometimes prescribed drugs, that are created from opium, which is a chemical that is found in certain flowers and plants. These drugs are usually known as painkillers, but due to the intense calming effect on the body it has, they are heavily abused and lead to addiction. These types of painkillers are usually prescribed after an injury or an accident by a doctor. The patient may think the painkiller is losing its effectiveness over time, but that's just simply due to the body building up tolerance to the drug. A tolerance can also cause a person to take a larger dose than their recommended amount in order to achieve the effects they want. Increasing the medication dosage can lead to a physical dependence, whereby they need to continue taking the drug to feel normal. Eventually, a physical dependence can lead to cravings, which are characterized by growing urges to continue using the drug, despite negative consequences that might occur. When a person's drug-seeking behavior scales completely out of control and begins to compromise their physical and psychological health, a full-blown addiction is present. An addiction is far more serious than a strong desire to use drugs. It is a neurological disease that feels inescapable to the person suffering, and it is still a huge problem throughout the United States today. 46 people each day die of a prescription opioid overdose. A telltale sign of an overdose related to these drugs include unconsciousness, confusion, nausea, vomiting, restricted breathing, constricted pupils, clammy skin, inability to walk, and extreme sleepiness. Some of the most common types of opiates are morphine, codeine, and heroin. Let's talk about stimulants. Stimulants can be viewed as opposites to depressants, as their effects are almost opposite of them. They are known as uppers, and the primary use of is to increase energy, concentration, and wakefulness. They perform the opposite of depressants in your brain, by instead increasing function in your central nervous system. Stimulants produce an overabundance of dopamine, the pleasure-inducing chemical in your brain. After continued abuse of stimulants, the brain no longer produces normal amounts of dopamine, as it has been conditioned to receive it from taking the drug. When the individual stops taking the medication, they experience withdrawal symptoms. This creates a physical dependency on the drug and requires the individual to continue using the drug in order to feel normal. In the short term, stimulants are believed to increase productivity and performance while producing a excited high of pleasure. But in the long term, stimulants are incredibly addictive and have a very high potential for abuse. Examples of stimulants include Adderall, cocaine, and meth. Hallucinogens, sometimes referred to as dissociatives, alter the user's perception of reality, often resulting in auditory and visual hallucinations, also known as tripping. Although hallucinogens are generally less addictive than other drug classifications, their immediate impact are generally more severe and dangerous. Some examples of hallucinogens are LSD, shrooms, and PCP. An addiction to this type of drug is less serious than the others, but the risk is still very much present. A physical addiction is marked by tolerance to the drug, meaning more is needed to achieve the initial high. It is also recognized by the presence of withdrawal symptoms when stopping use. A psychological dependence can take place when the user feels the need to take the drug more frequently, when the user goes through extremes to get the drug, when the user starts shirking responsibilities or friends and family in favor of using the drug, or continuing use despite recognizing the severe consequences of doing so. Inhalants are a lot different from the rest of the types of drugs listed in this video because the chemicals that are inhaled in order to achieve the high are not meant to be ingested by humans in any way. Some variety Some examples of inhalants are paint thinners, nail polish removers, and gasoline. While there is incredible variety between inhalants, most produce a feeling of a high. Inhalants are less studied than most other drugs. While they tend to be less addictive than many other substances, the use of inhalants is incredibly dangerous and causes many serious side effects. If you or a loved one are suffering from addictions of any kind of drug, please get the help you need for yourself or them in any way possible. Addictions of any kind are extremely dangerous and must be treated as quick as possible for the safest outcome. The anonymous SAMHSA hotline is 1-800-662-4357. 1-800-662-4357. Remember, I am not a doctor or a medical professional by any means. I am simply a high schooler that wishes to inform the public on certain information I obtained through research.